There are 11 additional cases, local cases of coronavirus in Victoria reported overnight. 10 of those were in the community during their infectious period. One of those was isolated for the entirety of their infectious period. That's a trend that will continue. Obviously, at the beginning of an outbreak, we have many more people who are not isolating, and then as the outbreak unfolds, more and more people will be away from others and not a risk to public health. There were some 38,987 test results received overnight. We thank each and every one of those nearly 40,000 people for going and getting tested. We are producing those results the day after the tests are taken. That's very important. That timely information is critically important to our contact tracing and to our outbreak management. Again, we thank everybody for going and getting tested this past weekend. I can confirm that since July 12 we've had 1 million test results come back through, so that's 1 million people who've gone and been tested. It's a fantastic effort and it's central to our fight against this virus. I want to also make mention, yesterday we had some significant announcements about expanding access for 18 to 39-year-olds to the AstraZeneca vaccine, and also some additional Pfizer appointments. We've had around 15,000 appointments have been made. Extra appointments have been made just since yesterday. We'll look to add more sites. We'll look to have more vaccine available. We'll look to have more appointments available over coming days and weeks. And that's a fantastic response to announcements only made yesterday. Some of those sites are already fully booked out till the end of August. There are still appointments there, and I think Jerome will speak to some additional Pfizer appointments that are available, many thousands of them in fact. But we knew that the AstraZeneca expansion yesterday would be very popular, and we see many people, around 15,000, that have made a booking, others I'm sure beyond that who haven't been able to yet, but we will add additional appointments as we can. Now, turning to some very positive news, after 4 days of lockdown and no cases in regional Victoria, I'm very pleased to be able to announce that Cabinet, both last night and confirmed this morning on advice from the Chief Health Officer, regional Victoria will be released from these lockdown measures and will return to the settings, snap back to the settings that applied last Thursday from 11:59 p.m. tonight. So that means the 5 reasons to leave home are no longer relevant. Schools will be open again from tomorrow. Hospitality venues will be open. People will be able to go back to work if they're an authorised worker, but if you can work from home, you should work from home. That is a very important decision, one that's made on the best of health advice, and one that is fundamentally the function of not having cases in regional Victoria. That's very important. We do have a conservative approach to these things. We don't want this virus to spread, but this is very positive news and speaks to the fact that we do have a degree of containment around these cases. There is a degree of localisation, if you like, to these cases, and pleasingly we haven't seen cases in regional Victoria over these last 4 or 5 days. So I'm sure that'll be welcome news to every single regional Victorian. Just on enforcement, the Victoria Police will be out in force, enforcing these rules wherever you are in the state. I would ask people to use common sense and good judgment. Don't travel to regional Victoria unless you need to, and indeed retailers and other businesses who are providing goods and services will be relying on them, as we have in the past, to be establishing the address of any customers. So there's no point going to regional Victoria. You won't be able to buy so much as a litre of milk without establishing that you're from regional Victoria. So no one from Melbourne should be going to the regions unless they have a valid reason, whether that be education, caregiving, work, where that is a permitted job, so on and so forth. People from regional Victoria can travel through Melbourne to get to another part of regional Victoria, but they need to use common sense and good judgment. This is all very simple. We are all in this together, and no one should be making any decisions that contribute to the spread of this virus. Please make good decisions, sound decisions, use common sense, and don't put at risk the fact that we have little, if any, virus in cases, that is, and virus in regional Victoria, and we're allowed to take these proportionate and very important steps to reopen back to the rules as they applied late last week in regional Victoria. I might also note that we've seen a very significant partnership between the government and all our contact tracers and all of those community leaders who are reaching out to different communities as part of this outbreak. The Altaqua College, I want to thank them for the amazing efforts that they've gone to. We've got something like 85 to 90% of all of those who needed to get tested have been tested. That, I think, is probably one of the highest and fastest performances we've seen of any school, anywhere, not just in Victoria, but I think that'd rank very well across school outbreaks right across the country. I thank parents, teachers and staff, and of course students who've gone and got tested and done so fast. That's critically important to us closing down, change of transmission, and being able to get around this and ultimately get out in front of it so that we can change these rules and have all of Victoria open again, as regional Victoria will be from 11:59 p.m. tonight. You'll have many questions, I'm sure, but before we go to questions, I'll just ask the Chief Health Officer to speak to these decisions and some of the cases. Then Jerome can take us through some of the details around outbreaks and some additional vaccination slots that are available in coming weeks, and then we're happy to take any and all questions you have. But today's a good day for regional Victoria, and in many respects a positive day for the whole state. To have 11 cases, we'd always prefer none, but 11 cases, they're all linked. We're starting to see now the first of the new cases coming through that have been tucked away, no risk to public health. They've been in ISO for 100% of their infectious period. That's the system working as it should, but we're still chasing very hard. We're not out in front of this yet. I think we're running alongside it, but we're not yet in front of this particular outbreak, and that's why we need people to get tested as soon as they have symptoms, isolate when they're asked to do so, access those payments. There's $450 if you can't go to work because you're waiting for a test result. There's $1,500 available to you if you've got to isolate because you've got the virus or you're a close contact. Those payments are there to be made. They're very easy to access. They're all about making sure that people can do the right thing, not just by their own family in terms of providing for them, but the right thing by every family by following the rules. Victorians are doing a great job in difficult circumstances. The traffic data is and not just the data, but anecdotally driving in and out of here yesterday. Very little traffic on the Monash, people doing the right thing, and I'm deeply grateful to each and every Victorian who is following the rules. That's what drives these numbers down. That's what gets us open again as soon as is safe.